Well, welcome to our webinar on the best run veteran-directed programs. We're excited to share insights and learnings from two of the leaders around the country who are leading successful veteran-directed care programs. So a little background on veteran-directed care. This program is now being offered by more than 95 VA medical centers around the country with the intent announced by the Veterans Administration to push it to all 170 locations around the country. So if you do not yet have it in your area, you will soon. And since inception, the Veteran Directed Care Program has helped more than 10,000 veterans. And the customer satisfaction surveys have indicated a 95% satisfaction rating, which I guess, when you think about it, this would be to be expected, right? Because as we know, being mortal is not optional. As one leader in the field of geriatrics is fond of saying at conferences, life is a sexually transmitted condition with 100% mortality. So when we think about our life goals and life patterns, when we survey older adults, 70 to 90% of them say that they would like to age in place. They would prefer to transition from this life at home and to die in their own comfort. But what happens in the United States is actually the inverse of this. A quarter to a third of us die in hospitals or in institutional settings. And the Veteran Directed Care Program really is designed to make our wishes come true around end-of-life issues by providing those wraparound services that assist aging veterans to be well cared for at their homes and to be where they want to be. So it's been a tremendously successful program. That's brought additional resources to area agencies on aging around the country. Those leading organizations like Western Reserve, AAA, and Age Guide, where they're executing the Veteran Directed Care Program really in a model fashion. So we have those Veteran Directed Care leaders with us today to talk about the Veteran Directed Care Program and how they're being successful. Now, why is Hucu sponsoring this webinar? Well, first and foremost, we believe in this program and assuring that as many veterans as possible have access to this high quality program. And the key difference is that the care is being directed by the veterans themselves. Once they enroll in VDC, they are unenrolled in other programs like home health aides, in-home respite, and adult daycare. So it's really important that the logistics of the program go well. And it's complicated, right? The veteran gets to hire their own personal care assistant, and there's a lot of logistics around managing that person in their home and making sure that that person gets hired effectively and paid effectively and all the things that assure that they get good care. So that requires efficient and effective communication. And we know that staffing is always a bottleneck for any service organization, and that's no exception for veterans care and for the Veteran Directed Care Program. But in order to manage those staffing bottlenecks, it's also important to manage communication. And that's really our question. For those of you attending the webinar, thinking about how to implement the best practices in veteran-directed care, how often is communication an issue for your team and for your partners in delivering this program? Because that's really where Hucu is making a difference. So over the course of the next hour or so, we're going to have a real world conversation with two leaders in the Veteran Directed Care Program. And these folks are deep in the trenches of making sure that the programs are run efficiently and effectively and that the veterans are getting the care that they need. So they're going to share practical tips, and they also are making themselves available for questions. So we want this to be interactive. As we have this conversation, if you have a question, feel free to contribute it to the chat in the Zoom, and we will answer those questions as much as possible as we go forward. So let me introduce these wonderful leaders in area agencies on aging who've agreed to share their time and expertise with us. So really pleased to have Tommy York, participating in our webinar. Tommy is responsible for 8 different programs at the Western Reserve AAA in Cleveland, of which Veterans Directed Care is just one. He has a wealth of experience as a social worker in the trenches, as well as a leader with consummate problem solving and team building skills. So Tommy has really impressed the Hucu team in the time that we've been working with him over years now. I think it's been 3 years. With his ability to really see a path forward for his team and blaze that trail with really great outcomes for the clients that Western Reserve Area Agency on Aging is serving. So super happy to have you here, Tommy.
Thank you. Good to be here.
Uh, and we also have Lucinda Hurt. Lucinda is the director of veteran directed care programs at Age Guide, which is a area agency on aging, one of 13 area agencies on aging in the state of Illinois. And Age Guide acts as both a service provider hub as well as a leader of spoke agencies that also provide services directly. So they have, some complexities to the way that they are managing the veteran directed care program and leading those subcontractors and delivering high quality services. Lucinda also brings more than 20 years of experience in social services leadership and was also recognized as Young Person of Illinois by the JCs. So she is an awesome person bringing a level of positivity and can-do attitude to everything she does, and we're really excited to have her here too. Thanks so much for being here, Lucinda.
Thank you. Thank you for having me.
And I am Laura McKee. I'm one of the founders of Hucu. I also have a background in post-acute care. My first entrepreneurial venture was with Autism Home Support Services. So I led an agency that provided care to thousands of families with children on the autism spectrum. And we launched Hucu in 2020 in order to make the lives of people like Tommy and Lucinda and the teams they lead, as well as the older adults that they serve, better. So how we're really focused on providing intelligent, secure communication. And so that's why we're here today to listen to Lucinda and Tommy speaking about their experiences with veteran-directed care in general and also around communication with the partners that they have. So, real quick, what you can expect to hear about today is how we have reduced administrative burdens and shortened referral process times for veterans through improved communication, and to really learn about how Western Reserve Area Agency on Aging and Age Guide are able to focus on the clients they're serving and less on administrative tasks like email and phone tag. So before we dive in, though, I want to, kind of ask at a high level, um, you know, communication can be really complex for veteran-directed care compared with other models. Tommy, can you maybe explain why communication is so critical to a successful veteran-directed care program?
Yeah. So the Veteran Directed Care program has so many layers, with so many parties involved. You have the VA, you have your FMS if you're subcontracting out, you have your person-centered counselors, you have the caregivers, you have the veterans themselves. So all those parties are involved trying to make sure the veteran gets the care that they need. And if one piece is missed or delayed, you're really causing a detriment to that veteran. So communication is key in making sure that veteran gets services that they need in a timely manner. So communication, I think, is the most important factor in the whole veteran directed care. And that's just we are only a sole provider. So Lucinda can speak as a hub, having to even add layers onto that.
Yeah. Yeah, we definitely, as like Laura said, we are a sole provider. We are the direct service provider for our area agency region, and that is across 3 VA medical centers. And then we also are the hub for the hub and spoke model So we are contracting with other agencies outside of our delivery network to and through other VAs to deliver services in their regions as well. So we have the basic communication like Tommy mentioned, but then we also have that added layer of having four VAs that we're working with continuously and moving communication back and forth with, but then also those spoke agencies, and we have two of those. And so as the hub, for those of you who aren't familiar, we are responsible for that communication. We're really the central piece of of the operation network. And so because we are the contractor through the VA. So we are responsible for sending and moving communication back and forth from the VA to the spoke agency and the other way around. So there's that additional layer of managing that communication across those two agencies and being that intermediary. And then also, certainly it compounds things with the FMS and just tracking all of that is an additional, puts additional communication load on us.
Yeah, no, that makes sense. And as I said at the top, when people speak about area agencies on aging and veteran-directed care, really any social services delivery, staffing challenges are always, first and foremost. Staffing challenges are always at the forefront. How much of the challenge in delivering veteran-directed care is staffing versus how much is communication, Lucinda? Like when you're managing your team, what are the
Yeah.
priorities that you really need to address?
Yeah. I think it's really important when we talk about staffing. Like staffing is affected by so many things, right? And in this program specifically, you're trying to coordinate all of these people together to make sure the veteran gets what they need. The case managers are working through veteran situations. Many of these veterans are at the highest level of care that they can be at. They are often on hospice and we also have to be able to plan for that when you're losing clients. That certainly impacts you. And just managing, helping veterans and authorized representatives manage all of those situations, but then managing the program on top of that. And so it's really important that we also then talk about program operations running smoothly and the communication, because even if someone is able to handle all of those other pieces, if we're not efficient and effective with our program management and our communication, that's going to put an undue burden on case managers and person-centered counselors. And so if all the things aren't working well together, then that affects the staffing and puts burden on the staff. And then we have that instability that happens.
Yeah, you really are spinning a lot of plates and needing
Yeah,
each
yeah,
person to spin the plates at the right pace, aren't you?
yeah, yeah, yeah.
Okay, well, so let's dive in a little bit deeper on that relationship. You kind of mentioned the three parties that are, as some people say, a three-legged stool, right? And you have to have them balanced or the stool falls over. So in the triangle of overcoming these communication challenges across your VA partners, your area agency on aging staff, and your fiscal manager. How does that really work? What are the challenges and how do you manage them?
I think for us, and I'll speak maybe more personally to me, like our biggest risk of breakdown is all of that back and forth in email with our VAs and managing that spoke communication. Our staff that are delivering direct services, they're connecting directly with the VA and managing their caseloads. But when we have, because we're that intermediary between our spoke agencies and the VA, all of the emails and the different communication channels can be hard to navigate and remember, did I update this? Did I update that? Did I send the information over to the VA and did I send it back over to the spoke agency efficiently and timely so that there isn't a delay in services or approvals that need to happen? We're managing, even though we're utilizing Hucu and just started doing that, we are still managing things with email and fax and meetings and spreadsheets. And it's a combination of things right now. And it's hard to track. And that is where breakdown can happen.
Well, and hopefully Hucu will be able to help streamline those things
Yeah,
over time as
yeah,
you further implement. Tommy, you've been
yeah.
using Hucu for a bit longer. How do you think about that challenge of managing all of the partners and parties involved?
Yeah, luckily we've been using Huku actually from day one of our Veterans Directed Care program. So our VA bought into it from day one. Our FMS has bought into it. So we have been using it to receive our referrals, to receive communication from our VA when the veteran is hospitalized. So it has helped with the communication. So when, for an example, when our veteran is hospitalized, our VA immediately puts a notification into Huku, so our PCCs are notified immediately. So then they can reach out to that veteran, see what's going on, and then go out and see that veteran to see if an update on the spending plan is needed. Do they need additional hours now after that hospitalization? So that way we can update spending plans, get that approved, get that over to our FMS. It speeds up getting that veteran the care that they need for that period of time after that hospitalization. It also excuse me, our FMS is also involved. So now they're aware, hey, there's an updated spending plan so that they can process it faster than all the email back and forth communication. So now they have that approved spending plan ready to upload into their system and get it approved as well. So communication has been, we have used Huku for that communication purpose from day one. So.
That is so fantastic to hear the level of, urgency and speed that you are providing these services with. I think about my grandfather and my uncles who are all veterans. And, at that stage of the game, they don't have time to waste, right? They really don't have a lot of time. And to know that they are getting the support that they need, and if that's hospice care or if that's other supports in their home. Just it, makes me feel good to be an American taxpayer and know that that's where our resources are going, that you're treating them with that level of compassion and respect and doing it as quickly as possible. That's really remarkable. And thank you so much for sharing that and, for the work that you do.
Thank you.
So let's talk about scaling because when you provide high quality services, you're going to grow, right? And growing in a sustainable way, in a way that enables you to manage your teams and add team members as quickly as possible is really critical. How have you thought about scaling your veteran-directed care program? What operational changes have made it possible for you to support more veterans? Maybe Lucinda, do you want to take that first?
Yeah, yeah. Um, it's hard. Our program has gone through almost every transition that a VDC program can go through this year. We've changed FMSs. I came on in the middle of the year as the new director. We've had some staffing changes, and we brought on new partners all at the same time. Um, so we're still learning all together and trying to figure out how best to streamline workflows, streamline that communication, and certainly Huku is part of that. And the regular training and standardizing operational things across all of the agencies and the staff that we're working with is really what we're striving for, and to improve our program as pretty much everybody. I think we sort of took a poll that everybody is kind of new within a couple of years, between even some of our VA partners and our staff and the staff from the spoke agencies. So we're learning together how best to do those things, and what will work for the future.
And what role does communicating effectively with
Yeah,
all of
yeah,
those
yeah,
newbies and, in
yeah,
developing your processes really play?
yeah. It really is the key to like it really is the theme of this, right? And the key to everything functioning as best as possible. And so, like right now, our Huku usage is between us and our FMS and our spoke agencies. We don't currently have our VAs in there yet for various reasons. Just certainly getting situated, and transitions are hard, and trying to learn new software and kind of get into a new routine of utilizing it is where we're only a couple of months in. So We really hope that that will help. It has already helped streamline communications just between the three parties that are in there, and we've had really good feedback from the staff and the FMS on that. And so we're just continuing to increase our usage in there and really maximizing how we can use it. And that's been the really big key for our communications across everybody.
Thank you so much.
Yeah.
And Tommy, when you've worked to scale your program, what do you think people really underestimate in terms of, what's hard about scaling?
I think dashboards, automated workflows, current tools, oversight of all of this programmatic stuff. I mean, if you're hiring your FMS, you kind of have to oversee them as well.
Mhm.
And then if you're working with multiple VAs, every VA runs their VDC program differently. So
Yes.
what is that VA doing? Then you have to understand what this VA is doing. Luckily, I only
Yeah.
work with one VA, so I only have to focus on that one VA's rules. But then you have to interpret what is the ACL's rules versus the VA rules. So I think this program, I think we all would agree it would be great if it was uniformed across the board. That's not how this program runs, because then each state has their own rules and regulations for direct care workers as well. So that would be amazing if that was the case. But scaling this program is all going to be based off of what is possible based off of your VA and their rules, regulations, and what workflows you have. Our VA personally, they've capped us at 50 um, veterans per PCCs. So if we get past that caseload, we have to hire more staffing. But Hucu has allowed us to communicate back and forth more effectively with our VAs so they know, okay, that they're maxing out at their caseload, and then they can see who's enrolled, who's not enrolled, and then we communicate more effectively so we know when to hire.
That's fantastic. That gives you some, runway and some visibility. Planning is the key to being able to execute. So that's great that you have that relationship with your VA to be able to communicate effectively what's coming down the pike. So let's talk about burnout. So this is a constant concern for all uh, social service agencies. You're dealing with people in high stress situations and complicated family situations. It can really lead to a lot of stress for your frontline staff. How much of case manager burnout do you think comes from administrative friction versus the work itself, Lucinda?
Yeah, I think gets back to our earlier discussion that, the job satisfaction really comes from that work that they're doing with the veterans and their families and being able to see that they're keeping people in their home and that people have quality of life with their families and the people that they choose to work for them and the services that they choose. And so again, if there's administrative friction and things aren't working well, it does lead to burnout, even though from a client perspective, their satisfaction might be great. If internally things aren't working well and functioning at the agency or in the program in general, that definitely leads to greater burnout. This program, I've worked in the waiver programs before, and I know some of the staff that I have also worked in those programs, and I think we have a lot less paperwork, and there is um, it's easier in some of those ways. There's less administrative burden, I think, related to paperwork and things like that. But then also, as to our conversations, that there's a lot more communication and collaboration that has to happen. And if those workflows aren't working efficiently, that's definitely leading to more burnout.
That makes sense. That makes sense.
Yeah.
So, what have you seen work best to protect your case manager's time, while, being able to hold them accountable for their work, Tommy?
I think a case management platform that sends alerts, stores documents, tracks deadlines to help reduce the administrative burden, while maintaining their accountability. We use standardized templates, notes, assessments. So anything that can minimize that administrative burden and allow them to spend more time with the veterans. PCCs get in this work to spend time with clients. It is a social service program, and they're there to assist the veteran. So they want to spend more time with the veteran, get to know the veteran. What does the veteran need? They don't want to spend all this time doing this administrative work, but it is a lot of paperwork, as Lucinda said. A lot of enrollment paperwork, a lot of FMS paperwork. Um, but if we can standardize a lot of it, then that will help with those administrative burdens and one system allowing all of this to be done instead of multiple platforms and systems, which is why we went with Hucu in the first place, because it's all in one system.
Yeah, no, that makes a ton of sense. It sounds like you're doing a great job protecting your team. So let's talk a little bit more about just real world success. What would be best practices when your area agency on aging peers or others, come to you and say, "Hey, we want to improve our veteran directed care program, or we want to implement a veteran directed care program for the first time." What does your effective day-to-day program look like? What would you point to as being best practices for success?
I think it really is that real-time communication and that visibility of information because unlike other case management, this is integrated with healthcare. So when you're working in the waiver programs, you're not contacting people's doctors, you're not working in a healthcare system, but this is an extension, this is healthcare partnership. And so it is essential that that communication and the visibility of information um, is present. That's the best place to start in making sure that's in place.
I would echo that. When we established our VDC program here at Western Reserve, we had all parties at the table to make sure voices were heard. We had our FMS, we had our VA, and the AAA, so that we could work out our workflows from the beginning and how communication would work with Hucu. So we knew all parties had to be at the table to make sure that the veterans' voices were heard.
That's brilliant. That's brilliant. Really get your stakeholders together and, talk through the step-by-step process. How are we going to make this work really efficiently and effectively? And if you have the right people at the table and the right processes and tools, you will be a best practice, top performing veteran directed care program. So we have a quick poll for those of you participating today. Let me go ahead and skip to the poll, and we will be pushing that poll out for you to answer. And in the meantime, if you have questions that you'd like Lucinda and Tommy to answer from their perspective, please go ahead and send us those questions in the chat, and we'll respond as best we can. And if we can't respond on the fly, we'll have to follow up afterwards. And if you want to give us your email or send me an email, I can forward it to our panelists. I've put my email in the Zoom window there. You can reach me at laura@hucu.ai. And if you have any, more complex questions that you don't want to ask on the fly, feel free to send us an email after the webinar. So the poll is live, and if you could answer which of the following operational bottlenecks are most impacting your veteran-directed care program, please select one or more of the answers. Well, excuse me, you select one answer, but you can select all of the above. So we're interested in which is the most critical issue from an operational perspective. And we're just going to give it a minute, I think, to have people respond. Uh, will we be displaying the results? So, do we have some results to display,, Fazan? We're just going to give it another minute. So I'm sure you all have some great stories of the veterans that your teams are serving. What gets you up in the morning? Do you have any examples of veterans for whom this program really was kind of, essential to their quality of life, as you mentioned before, Lucinda, or the quality of the family's life? It's really, not just for the veteran, but their whole, family.
Yeah, I'd be happy to share. Actually, last week, I think we finally got the approval. One of our veterans, who is a younger veteran, and catastrophically disabled, lost his authorized representative, um, due to an unfortunate situation that it's uh it's out of everybody's control, and
Mm.
there's, it may be a long-term situation, but that person was also his informal caregiver. And so he's incredibly supported by the VA put together a care plan temporarily. He had to get a new guardian. He A temporary guardian from an agency. He works with wounded warriors. Their respite care got involved. Lots of different. It's really the ideal example of everybody coming together to support this gentleman and to remain in his home. And so while the temporary care plan was in place, he certainly had VDC also as part of that care plan. The VA and Age Guide worked to request a case mix level V, from the national office, which is a case mix I've never used before. I've been in and out of VDC. It's not something it's something you have to ask for permission to access. And thankfully, last week that was approved by the national office, and so he can now remain in his home with full-time care with his current caregiver and some additional agency-based services, instead of being in a facility where, I mean, he's in his early 40s, and it, being in a facility would not be appropriate for him. It would certainly, I'm sure, initiate decline, at that age. And, he does get out of the home and has some additional therapy, like non-traditional therapies like equine therapy. It's not part of his VDC plan, but it just to be able to request that and to get him to stay in his home, especially in this turbulent situation that he's found himself in, by no fault of his own, or even maybe his AR. It's been a really big win and success. It's been a great learning opportunity for us too. We've never encountered that situation. So now that we've requested it, we'll see. We can request it again
Yeah.
when we need to, but it's such a great success story for him, to be able to stay in his home and access 24-hour care, through that additional special request that we were able to put in.
No, that's a great
Yeah.
example. And,
Yeah.
veterans have gone above and beyond, serving
Yep.
our country. So to be able to go above and beyond for them so that they can stay in their home with their, friends and neighbors close by, as opposed to having to go into some
Mhm.
institution, that's tremendous.
Yeah.
That's great.
Yeah.
Tommy, do you have any examples you'd want to share?
Yeah, so we actually have a veteran who admitted that he was about to give up on life in general. And we got him enrolled in veteran-directed care, and his daughter is now his primary caregiver, who was unemployed and now is fully employed through him. And the success story is actually up on our website. And now they get to spend more time together. He's leaving his house. And he said without veteran directed care, he doesn't know where he would be today. But now he gets to spend all this time with his daughter. Um, so that was just heartbreaking to hear.
That is
That they were
beautiful.
both they were both at this low point in their lives, and veteran directed care could help them both.
That's beautiful. That's really a great story. Thanks for sharing that. So the poll came back, and number two was the most commonly selected issue or operational bottleneck that needs to be addressed. So time spent chasing the FMS or the VA for updates. So that makes sense that Huku is helping with that. So we got a couple of other questions submitted. How do high performing programs make sure everyone is working off of the same page of information without constant meetings and people spending time face to face?
I'd say we're still in meetings, so I'm going to have to postpone that answer.
Okay.
With so many VAs and our other partners, meetings are essential. We don't have a lot of them. We have monthly meetings with our network and with our VAs because it is important for our VA partners. Some of them like to hear the update specifically because that's their learning style. So they still want to do that. Even if I think even if they had access to notes, they might still want to have that conversation. So we're still in meetings. We do find that it's appropriate, but we're trying to limit those if we can.
Yeah, with us, if it's veteran specific, everything is in Hucu, so the VA just goes in Hucu, reads our notes, and we don't really have a meeting with our VA unless it's like a health and safety concern with our veteran. We do have monthly meetings though, with the VA with policy updates and things like that. But if it's veteran specific, if it's not health and safety concern, they just go in, read a note. If they have questions, they just pop it into that veteran's channel, and the supervisor or the person center counselor responds right into that channel. So everything is it's the channel specific for that veteran. So it's just right then. So
Wow,
meetings
that
are
really does sound like a time saver. And makes sense, right? I always get on my little soapbox about communication. Of course, there's no substitute for face-to-face communication, but we can't be everywhere, at once. And once you have a relationship, texting can be so efficient, and really, helps free up that time that you need for the more complex face-to-face meetings. So thank you for sharing that. So when you think about VDC programs and if they're set up for growth, would you think that they might be limited by their current workflows? And how would you, enable them to grow?
I think the limitations can be on both sides. I think it can be on the area agency side as the service delivery partner, but then also from the VA side. So we experience both. I mean, we certainly don't want to be limited in our growth potential, but we do need to scale so that we do need to be efficient so that we can scale and keep growing. But we also experience the VAs having limitations at times, maybe their own workflow that we aren't really able to, maybe communication would help. Maybe having them in Huku might help, but depending on what their communication and their financial situation is at the VA, that's also going to limit, their scalability. And we're experiencing that with a couple of our VAs. Some of them have limits on programs, and some of them don't. And we there's not growth potential for factors that aren't we can't really
Yeah.
influence that much.
There's only so much
Yeah.
that is under
Yeah.
your control, and certainly the
Yeah.
VAs
Yeah.
are facing, pretty complex environment right
Yes.
now.
Yeah.
So more we can help them accomplish their mission,
Yes. Yeah.
so much the better for everyone if we can make it more
Yeah.
efficient and effective and, give them one less thing to worry about.
Yes.
Um,
Yeah. Yeah. And if
then
we can scale our
hopefully,
operation and be the most efficient, how do we then influence the other, up to their level? That,
yeah,
hey, our efficiency will help them be more efficient to maybe either take more people on or, um, if that's convincing them to hire, whatever that looks like, our efficiency can influence theirs as well. Yeah.
yeah, no, makes sense. So one more question came in. What's one common mistake that you see for veteran-directed care programs? What would you point to that you could save someone, the trouble of making that mistake? What do you think are common mistakes that veteran-directed care programs make?
Good question.
Like I said, we had people at the table when we first launched, everybody. If you're just trying to vacuum this and not and like talk to the VA over here and your FMS over here, I feel like that's a huge mistake. You want everyone at the table. I think people don't like when their FMS and their VA talks. Um,
Mm.
but my VA is clear. Like we hold the contract with the FMS, so it's our ultimate responsibility with that FMS. But our VA also will say, that's your FMS's responsibility. You really need to make sure that they're doing that. So I think it's okay that they talk, um, but RVA is clear, like it's ultimately our responsibility to make sure that FMS is doing their job. Like it's okay people talk to each other.
That is super helpful, Tommy, because what I heard in your answer was it's really important to have clear roles and responsibilities and accountabilities. And ultimately, if the area agency on aging is administering the veteran directed care program, the success of the program depends on your holding those partners accountable. And the fiscal agent has to do their part and be held accountable in order for the veteran to get the services that they need in a timely way. So having the communication where all three of you are on the same page has to be really, really helpful.
Right. So, an example, a veteran can call into the VA because, there's multiple people that they can call into regarding this program and say, there was something wrong with my payroll this week. The VA will go in and leave a message, but they'll alert the FMS and they'll alert the PCC. They won't just alert the PCC. So it's fine that they've alerted the FMS as well because ultimately it's going to be the FMS that has to fix that payroll. It's okay that they did that for us. But it's ultimately the PCC's responsibility to follow up with the FMS and make sure that it gets corrected.
Yeah. So when problems happen, it needs to get to the person who can fix it.
Right.
And ultimately, your PCC, needs to be efficient in managing all the different challenges they have. So, being able to communicate directly with the person who needs to fix it has to help.
Yep. So you don't have to bottleneck it and send it to the PCC who then sends it to the FMS. Just send it to
Yeah.
who needs to fix it.
Direct to the problem. That's fantastic. Well, awesome. Well, thank you all so much for spending the last 45 minutes with us talking about veteran-directed care. I certainly learned a few things. Is there any other parting thoughts that you might have for other organizations that are looking at improving or implementing a veteran-directed care program? What are your last thoughts?
My last thoughts are we like to test things. They don't work. Redo it. You know that, Laura, I'm sure, working with me. Never, never be scared of testing things, trying them out. If you haven't already started sending out satisfaction surveys to your veterans, those are a huge help. We send those out to our veterans. That really opens up a lot for us. We've changed our handbook that we've given our veterans because of the satisfaction surveys. Um, they said that there was a lot of material in there, so we've kind of broken it down to make it easier to read. So I would say if you haven't started satisfaction surveys, those are a huge tool that would be helpful. Another
Fantastic. Any last
communication
thoughts,
tool.
Lucinda?
Yeah. I think I'd echo that, like not being afraid of change. And if you try it and it doesn't work, you shift or you improve that thing, or maybe you have to abandon it altogether, whatever that looks like. But change is constant, and we can't get better at what we do. We can't scale if we're not open and willing to change and look at our operations um, and improve them. Yeah.
Well, thank you both so much for sharing your expertise and helping us really learn more about implementing successful veteran-directed care programs. We really appreciate how innovative the two of you are and how committed you are to providing great quality services and leading your teams and supporting them in ways that make them more impactful and more successful. It's just such a pleasure to have you as partners.